So we've been doing a series on implant therapy, especially when it comes to deficient bone. So we had a patient asking about zygomatic implant therapy. So let's look at zygomatic implants very briefly in this particular video. Hello, this is Dr. Arun from Dentistry, running a dental centers at Chennai, Raja, Namlipuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So when it comes to dental implant replacement, of course, and especially when it comes to full arch implant replacement for the upper arches, upper arch is otherwise called the maxillary arch. So let's look at an example and then try to explain where does zygomatic implants play a role. For example, in this particular patient, we are seeing very few upper anterior teeth that is remaining, and most of the upper teeth are having less than 20% bone here. So it's like, and then if you look at the sinuses, so in this particular patient we are looking at sinuses that are completely enlarged, and below the sinus there is absolutely no bone. Bilaterally the sinuses are completely enlarged, so there is no bone under the sinus to place implants. Also in the anterior region also there is very little usable bone for us to place implant. So it's an extremely deficient maxilla with whatever few teeth that are there are failing in nature. So when it comes to such situations, so we are looking at, and when you're planning an implant replacement, the minimum number of implants that is required for a full arch fixed restoration is 4 in number. So when those 4 implants are not possible, especially because of the extremely poor quality of bone that is there in the maxilla, then the options would be to either graft the maxilla, graft the maxillary sinus, and then once the graft matures in place, get those 4 implants in place. That is one option. The second option is typically like a graftless approach, where we try to use not just placing implants in the maxilla but also in the zygoma. So now how do we go about doing that is, of course we do a thorough, we do a CBCT planning, and once we do the CBCT planning, so you can see this particular case here where these 2 implants or the implants that are placed in the zygoma, and we are able to use whatever little bone was present in the anterior maxilla to place these 2 implants. So these are what are called zygoma implants. Here what we do is we are giving the patient an immediate solution, an immediate fixed solution, where these zygoma implants are placed and anteriorly 2 implants are placed. And so we have a minimum of 4 implants. In this particular situation we managed to do 5 implants. More the implants the better, and then we are able to give an immediate fixed restoration for that particular patient. Of course, the first restoration what we give will be a provisional restoration, and which the patient will wear for a period of 3 to 6 months time, and then subsequently this provisional restoration will be changed to the final restoration. So zygoma implants basically can be used as a last resort, because when there is not much of bone that is present in the maxilla for us to restore teeth with implants. Alternatively, when the patient does not want a bone graft or cannot take up an extensive graft surgery, also we can use zygoma implants to restore the patient's lost teeth. Hope you like this video. If there are any questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.